Chlamydia. Chlamydia is one of the most common sexually transmitted infections and is caused by a bacterium called Chlamydia trachomatis. It affects both men and women. It often causes no symptoms, so people can pass it on to others without realizing they are infected. When symptoms do appear, women may complain of discharge, while men may complain of burning during urination and discharge from the penis. If left untreated, it can lead to serious problems such as infertility in women, ectopic pregnancy, or pelvic inflammatory disease. Chlamydia can be completely cured with a simple course of antibiotics. But prevention is very important. Using condoms, regular testing, and monogamous sex life are the most effective ways to prevent infections such as chlamydia. Gonorrhea. Gonorrhea, also known as gonorrhea, is a sexually transmitted bacterial infection caused by the bacterium Neisseria gonorrhoeae. It can affect both men and women. The most common route of transmission is unprotected vaginal. It usually presents with symptoms such as burning during urination, white or yellow discharge from the penis, and in women, vaginal discharge, abdominal pain, and irregular bleeding. However, some people may have no symptoms at all. If left untreated, it can lead to serious problems such as infertility or pelvic inflammatory disease in women and testicular inflammation in men. It can be diagnosed with a simple urine or discharge test and usually resolves completely with antibiotic treatment. Condom use and regular sexual health checks are essential for prevention. Syphilis. Syphilis, medically known as syphilis, is a serious sexually transmitted infection caused by the bacterium Trichomoniasis pallidum. It is usually transmitted through unprotected sexual contact. Syphilis progresses in 4 stages: primary, secondary, late, and advanced. In the first stage, a painless or chancre forms in the genital area. The second stage, skin rashes, sore throat, fever, and fatigue may occur. In the latent stage, there are no symptoms, but the bacteria are still in the body. If left untreated, syphilis can be fatal, damaging the brain, nervous system, heart, and other organs. Early diagnosis is very important. It is easily diagnosed with a blood test and can be completely cured with antibiotics. The most effective way to prevent syphilis is to use condoms and have regular sexual health checks. Genital herpes is a sexually transmitted viral infection, usually transmitted by herpes simplex virus type 2 HSV-2 and sometimes by type 1. The most common mode of transmission is unprotected sexual contact. After infection, symptoms such as painful, fluid-filled blisters in the genital area, burning sensation, itching, and sometimes pain during urination are observed. The initial infection is usually more severe, but the virus remains in the body and can cause recurrent attacks. These attacks can be triggered by stress, illness, or low immunity. There is no completely curative treatment for genital herpes, but antiviral medication can relieve symptoms and reduce the risk of transmission. Condom use and regular health checks significantly reduce the risk of infection. Human papilloma. Human papillomavirus, or HPV, is one of the most common sexually transmitted viruses. There are more than 100 types, and some types can cause genital warts, while others can lead to serious diseases such as cervical cancer. HPV is usually transmitted through unprotected sexual contact, and many people can be carriers without realizing it. Most infected people do not show any symptoms, and the immune system can clear the virus over time. In some cases, however, the virus remains in the body and can cause cellular changes that can develop into cancer. The most effective way to prevent HPV is to get the HPV vaccine, use condoms, and have regular pap smears pap tests. Vaccination, especially at a young age, greatly reduces the risk of cancer. It should not be forgotten that HPV affects both men and women. Therefore, conscious prevention is important for everyone. AIDS. HIV, the human immunodeficiency virus, is a virus that weakens the immune system and leaves the body vulnerable to disease. HIV is usually transmitted through unprotected sex, blood, injecting, drug sharing, or from mothers to their babies through childbirth or breastfeeding. Once in the body, the virus may not cause symptoms for many years, but the immune system gradually weakens. If left untreated, HIV progresses to the final stage called AIDS. In this stage, even simple infections can make a person seriously ill. There is currently no definitive cure for HIV, but with early diagnosis and regular antiretroviral treatment, the virus can be suppressed and people can live long, healthy lives. It is very important to use condoms for protection, to get tested regularly, and to have a conscious sexual life. HIV-positive individuals should be supported, not stigmatized. Trichomoniasis, medically known as trichomoniasis, is a sexually transmitted infection caused by the parasite Trichomonas vaginalis. It can affect both men and women, but women usually have more pronounced symptoms. It is most commonly transmitted through unprotected sexual contact. Women may have symptoms such as foul smelling, yellow-green vaginal discharge, itching, burning in the vagina, and discomfort when urinating. In men, it is often asymptomatic, but in some cases there may be burning during urination or slight discharge from the penis. Trichomoniasis can be easily treated with antibiotics. However, if left untreated, it can affect reproductive health in women and increase the risk of HIV infection. To protect yourself, it is important to use condoms and treat both partners together. Even if there are no symptoms, getting tested and having a conscious sexual life are very effective in combating this infection. Hepatitis B. Hepatitis B is an infectious disease that affects the liver and is caused by the hepatitis B virus. The virus can be transmitted through blood, sexual intercourse, and from mother to baby during birth. Hepatitis B is usually asymptomatic or causes mild flu-like symptoms. However, some people may experience symptoms such as abdominal pain, fatigue, and jaundice. If it becomes chronic, it can lead to serious diseases such as liver failure, cirrhosis, and liver cancer. Although there is no definitive treatment for hepatitis B, the disease can be controlled with early diagnosis and regular follow-up. The most effective prevention method is the hepatitis B vaccine. It is also important to pay attention to hygiene rules and avoid unprotected sexual intercourse to prevent contact with blood and body fluids. Hepatitis C. Hepatitis C is an infectious disease that affects the liver and is caused by the hepatitis C virus. The virus is usually transmitted through blood. For example, it can be passed through shared syringes, blood transfusions, or contact with unsterile medical instruments. The risk of sexual transmission is lower than with hepatitis B, but unprotected sex can also pose a risk. Hepatitis C is often asymptomatic, and the infection can progress silently for years. When it becomes chronic, it can lead to liver damage, cirrhosis, and liver cancer. Today, there are effective antiviral drugs for hepatitis C infection, and treatment can completely clear the virus from the body. The best way to protect yourself is to avoid blood-borne transmission, use sterile equipment, and lead a responsible sex life.